morning, everyone. My name is Jez Stannard. I'm the Senior Lead in Public Health England for homelessness and rough sleeping. So just a couple of quick words from me to kick the webinar off, and then actually, unfortunately, I will have to leave for another meeting, but you are, of course, in very capable hands with ILLY colleagues, and also PHE colleagues are on the line. So firstly, just a warm welcome to you all to today's webinar. The webinar is to hear from the team at ILLY about the new monitoring and case management tool that we've commissioned them to provide, that is available to the rough sleeping drug and alcohol treatment grant areas to use. But firstly, I do just want to grab this opportunity to say a huge thank you to you all for the work that you're doing to continue supporting this programme. Many of you will have heard us say this before, but the rough sleeping drug and alcohol treatment grant is a very high profile funding programme. Working with the Ministry for Housing, Communities and Local Government, we were successful at budget in March last year for securing this funding to improve drug and alcohol treatment services for people who sleep rough and also people at risk of sleeping rough. And this is the second year of what we hope will be a 4-year funded programme. And people will also be aware, I'm sure, of the considerable political interest in this area around rough sleeping and also in the drug recovery agendas. As we all know, the government has a commitment to end rough sleeping by the end of this Parliament, and the expectation is that this grant will contribute towards that. So, you know, just to restate the point, this grant programme is very much a priority for both the Ministry for Housing, Communities and Local Government, who are the funding department for it going forwards, and also, of course, for us as a delivery partner for it, and will be and will continue to be for sure as the health improvement function of Public Health England transitions over into the new Office for Health Promotion in October. So just a couple of super quick words about the tool itself, and firstly a massive thanks to ILLY for creating what I hope you will agree after this webinar is a fantastic and extremely useful tool. So just a bit of background, PHE has commissioned ILLY to produce this tool. It's been designed for staff in the new rough sleeping drug and alcohol treatment teams to use in order to meet PHE's reporting requirements for the programme. So its use is optional, but it is a great tool, so we do recommend that areas use it. It will replace what we have been calling the row level tool, which we shared with areas as a temporary reporting solution. And once the ILLY tool is live, areas will then basically have the choice between submitting their data to us using the ILLY tool or by sending your aggregate data returns from existing data systems. That this ILLY tool is available for rough sleeping drug and alcohol treatment grant areas to use free of charge, and ILLY have developed it also so that it provides a really useful case management function, and the team will talk through all of this in a minute. So just a final couple of points of clarification actually that came up on the first of these webinars that we ran yesterday before I hand over to ILLY. So just to clarify, the reporting that's required for the rough sleeping drug and alcohol treatment grant is separate and in addition to NDTMS. So this tool captures the activity data that's required for the monitoring of the grant programme, which is for all of the people who are engaged with the rough sleeping drug and alcohol treatment grant teams, whether they've engaged in structured treatment yet or not. So just to be clear, the tool does not fulfill any NDTMS requirements, including, for example, around the treatment outcomes profile, or replace any recording of structured treatment. So once someone engages with structured treatment, this then needs to be recorded using whatever NDTMS systems are in place locally. And just one final point that came up yesterday, client records are not linked between this tool and the ILLY care path or any other systems for recording structured treatment. So even if an area is using ILLY care path and the rough sleeping drug and alcohol treatment grant ILLY tool, there will be 2 separate client records. So I'm going to hand over to the ILLY team now and Dinesh, who is going to introduce the tool. Over to you, Dinesh.
Thanks, Jez. And thank you to everyone for making the time to attend this presentation. We had a fantastic session yesterday where we had over 60 odd commissioners and service providers attending as well. So had quite a healthy debate as well. So today, I have the privilege of presenting the hard work and effort that both PHE and the ILLY teams have been doing. And for us, it's Christmas has come early because this is exactly the kind of work that we've been wanting to do. We've been wanting to make a real difference in the sector, and we hope that what we will show you is the kind of things that you're looking for as well. So this is where we are. So in terms of today's presentation, what we have got is we'll make an introduction of ourselves to you. We will show you what the rough sleeping project is about from a technical perspective, as well as show you how the tools will fit together. So we've got a really good demonstration by my colleagues Tara Chatterton and also by Tom White, who's also going to be presenting as well. And so firstly, to introduce ourselves, as ILLY, we're a software house. And I explained that for a long time we've been trying to make a real difference in our communities. We've been and we're working across up and down the country, either through providers directly or through local authorities as well. And key within this is that we've been working with the service providers as well as commissioners to make sure that the tools that we offer are relevant and useful for yourselves. And so when we were talking about the work that we've been doing for the Rough Sleeping Initiative, we went through a tender and we went through all the bidding process and lots of checks and validations of security and so on through PHE and NHS processes, and here we are now. So in terms of the core process of the Rough Sleeping Initiative, there are about 43 local authorities or organizations that have received the rough sleeping grant, and through that process the local authorities have engaged either one or more providers to help deliver that initiative, and through that process they are delivering the work. And the feedback that we've had is that it has been that some of the local authorities are well in advance of their service delivery. Some of them are still trying to get providers on board. Some of them are still concluding the tendering processes or staffing, and that's where the reality is. But either way, in terms of the initiative that we've got, is that once you have got those services working, there's an expectation that there will be a data return coming from, and then this is what we're going to be talking about: is how is the data return going to be coming on, and how are we going to facilitate that? Yeah. So from a technical perspective, this is what I'm going to be talking about. So at the moment, you've been given your spreadsheets, and there's loads of tabs in there, and you have a choice as to how you do your data returns. Now, those data returns can either be consolidated data, that's just round figures that will tell you this is what the activity is going on, and through that you have a choice of either doing consolidated returns or raw level data returns. Now, the raw level data returns is looking at what's happening at an individual level. Where is the funding going? What's happening about those? And that's where the two differentiations are. So if you have chosen to do the consolidated data returns, then you'll follow that process exactly as you're doing it at the moment. But if you are using the raw level returns, i.e. what's happening per individual, then we will transfer that data into CarePath, and that raw level data is what we will basically process and submit on your behalf to PHE automatically. That's happened as you're going along. But what will happen is that all the forecast data, the budgetary and the regulatory sort of the expenditure stuff, that will still be between yourselves and PHE, and that will happen between the commissioners. But we will take care of the client data. So that's how that's going to fit in. So In terms of the role level data, at the moment it's a spreadsheet. It's basically client data, and that's what the role level data tool looks like. So what we have got is that we have developed a tool which is CarePath, and we've configured it. So we've replaced the data set that it supports. So it's not NDTMS. It supports very much the rough sleeping data set. And what we've done is configured that so that it meets the requirement. And this is what my colleagues Tara and Tom will show, and how that is integrated into the what key workers will use, what service managers will use, and likewise what commissioners and PHE will use. Now, what I will do is I'll now hand this over to Tara Chatterton, who will then start the demonstration. Over to you, Tara.
Okay. Thank you, Dinesh. Before I demonstrate the dashboards available, I'd just like to spend a minute running through the data model that we use behind these. So we have our data that's entered using the Links CarePath case management system, and this is used by various groups for different uses. So for example, service managers and workers need to view the client level records and case notes to be able to appropriately support the clients and manage their caseloads. So they'll be viewing the client identifiable data, say the case notes that are entered against them to say what contacts have been done. Now, commissioners need to be able to view the work that's undertaken on their behalf within their areas, but not need to see the client identifiable data. Commissioners generally don't need to see the names and dates of birth and such, just need to see what work's being done in those areas. And then Public Health England will need to be able to view the work that's undertaken across all the local authorities. So they'd have visibility on anonymised rough sleepers data set items only. So not necessarily all the the contacts that have been done with the clients and the case notes, but just the rough sleepers data items, what the engagement is, what assessments have been done, what the client's needs are. So, however, everybody's viewing the same data, the same underlying data, but the view that they have access to is filtered depending on their role. So with the reports that we're showing, as the date, because it's the one data model, it's the one data set, as soon as the data is entered, as soon as service managers have entered that data is then visible to commissioners and PHE based on what their restrictions and what their view is, but then that's instantly actually available. Now, the consent model and the structure that we've configured within the case management system, this also ensures that each local authority and any agencies working within that local authority only have access to see the data relating to the clients within their area. So workers within one local authority will not be able to view clients that are in service with other local authority areas. That's by default. If the client explicitly grants consent, so if a client was being transferred between local authorities, they were moving out of area, if they grant consent, then you can grant consent and then the new local authority will have view access on the work that was done previously, but that's on a case-by-case basis, client-by-client basis. That's not by default. By default, you can't. Each local authority can only see the clients that they are working with. So in this demonstration, what I'd like to walk you through is two views provided on the data capture. So the first is to show you the view that Public Health England will have on the data, and then second is to show you the view that yourselves as commissioners and service leads will have on that same data. So what I'll do is I'll just switch to Power BI. I just pull the screen across. Right. So all these reports and dashboards are real time, so they're updated as the data is entered in the case management system. So this means that for reporting, you don't need to generate separate submissions or reports to send through to PHE. If you're using the rough sleeping system, then the data is automatically available as soon as it's entered. So this replaces the need to complete the row level collection tool. If you're using the row level collection tool and you switch to this, then you'll just use the case management system, and then that reporting requirement is automatically covered by the dashboards that are available. Now, from the main dashboard, you can view the data from local authorities. So you can view the local authorities as they are onboarded onto the system. So as a local authority starts to use the system, then that area will light up to indicate that there's actual data available to view. Now, at this level, data can be viewed across all local authorities. So if I go into one of these reports, you can see that from this level, you can view all local authorities. You can choose to select a subset of local authorities, or you can view data for just a single local authority only. What you can also see that this is our demo environment. So as you can see, it's dummy local authority names and it's test data only. What you can also do on this is you can filter the reporting period that you want to report across. So at the moment, the aggregate report is returned quarterly, but you can view those counts and that data on a monthly basis, 6 monthly basis. You can change the reporting period that you want to view. Now, the aggregate dashboard, this shows all the counts and totals that would be reported on the quarterly aggregate return on that spreadsheet. The figures are broken down by basic demographics, health, housing. So all the sections that you have within that spreadsheet, all those figures are covered and the counts are covered by this dashboard. However, because the dashboards are dynamic, this means that you can cross-filter across the different areas. So for example, if I go to health, if I click on here, we're looking at a breakdown of episodes by the drug group. If I click on alcohol and non-opiates, so I'm filtering by that subset, you can see all the other visualization, all the other counts are also automatically filtered down to that subset as well. So it gives you that flexibility. However, the aggregate dashboard only shows counts of clients. It doesn't show individual row level client data. So the aggregate report reports counts across consenting and non-consenting clients because you're only getting anonymous counts coming back. What we have is also the active client dashboard, and this kind of mimics the row level tool. So this reports on that row level client data, and therefore it only reports across clients that have consented for their data to be submitted to Public Health England. So here, client names, date of birth, they're not available here, they're not disclosed in this report, but the row level information is provided. So this is similar to the row level collection tool, where if you're submitting that to PHE, it will anonymize some of the data out of that. But because this is row level information, this allows you to do more in-depth analysis of the outcomes on an individual level. So for example, because you've got row level data, you can start to look at information on how long clients are actually spending in service with yourselves. You can report on outcomes and then start to break that down by demographics or drug group. Because you've got the whole kind of like row level information, you can track what's actually happened on that episode. So what you can do on this information is you can actually drill down into it, and this will give you the row level return. So as you can see the field headers and such, this basically mimics the row level collection tool. So Public Health England are able to download this data. You can export this data as a CSV file very easily, and then you can do whatever additional analysis you might want to do with that. Now, the last report is looking at data quality. So this returns counts, such as the number of clients that haven't granted consent at the moment, or number of clients where particular fields maybe haven't been populated. And on this, you can drill through, but on the drill down on this, it will just give you the client reference. So it's non-client identifiable data. So it allows, so say there was a high number of non-consenting records, then PHE can communicate to yourselves, or you can communicate with your service manager to say, well, look, there's these clients. It's a unique reference to the system. It's not identifiable client data. So you can refer those references back to the service to say this is reference, and then they can use that to uniquely identify the client and say, oh, well, have I asked about consent? Or maybe they have explicitly rejected granting consent. So all these reports are these 3 reports which I've shown here on the Rough sleepers data are also available to commissioner and service managers. However, you would only be able to view on your own areas, so your local authority. So Public Health England view, they've got across all the local authorities. On your view, you would just have your own local authority available. What I'll do now is I'll log in as a commissioner, and as a commissioner would, and demonstrate the view that is available to commissioners and service managers. Now, these reports are available via a URL and require a login to Power BI. If you've got access to Office 365, then you'll most likely already have a Microsoft account that has access to this tool. I'll just show you now how you would log in. So it is just a URL that we would give to yourselves. If you go to that URL, takes you to the Power BI application that we have. Oh, hang on, let me just come out of that. I need to log out first. Apologies. I'll sign out as the local authority user, and then I will log in to the Commissioner dashboard. Right, so now I'll log into an account that has just Commissioner level access. Okay, so this has gone to the Commissioner and Service Manager dashboard. Now, the first thing that you'll notice is that you've got some additional reports available here as well. So these aren't available to Public Health England. Now, these are our standard case management dashboards that show you information beyond the rough sleepers data set on the active clients that you have in your service. Again, because this is just our demo environment, obviously the data is just test data and we haven't got a large backlog. But what you will be able to see is things like trends, the count of clients that you've got active over periods, over time. You could be able to break down those clients by how far they are in their treatment journey. So, for example, you can get a breakdown of the clients that are currently active by how many are still awaiting assessment, how many have started maybe non-structured interventions, how many have been discharged, etc. So you can start to break down the clients that you've got active with yourselves. It's also a view on referrals, so you can get more information on how clients are being engaged, but also, especially if you're working in multi-agencies, how many onward referrals have been made and where are those referrals actually being made to. And again, you can drill down onto that information to get to see more details for those clients as well. And then, as mentioned, you'll have access to the rough sleepers dashboards, but only to the local authority that you've been associated to.